The Antepartum Encounter Note in Waiting Room Solutions has all the data elements and charting convenience of the traditional ACOG antepartum forms. Let's chart out a basic encounter for the first visit for an antepartum care. The patient is here after a positive home pregnancy test. The standard gynecological history can be taken including menstrual history, sexual activity, and pregnancy history. Genetic screening questions can be charted. Next, I'll chart the patient's infection history. If the patient is experiencing other symptoms, this can be charted in the review of systems. If the review of systems is normal, this can be quickly charted with a single click. Laboratory tests for the different stages of pregnancy can be viewed. Waiting Room Solutions have bidirectional laboratory connections with all of the major reference laboratories. Trimester-specific educational counseling can be charted. Educational emails can also be sent to patients based upon their diagnosis and medical conditions. The WRS Patient Portal allows patients to enter their medical conditions, family history, medications, allergies, social and surgical history, so that information can be automatically transferred to the Antepartum Note. Pertinent family history can be entered or elaborated upon. Patient medications can be entered, including allergies. This patient is taking Accutane. We see a medical condition to medication interaction, which alerts us that Accutane should not be taken during pregnancy. Previously reported medications can be easily reconciled. Now let's enter the data for the antepartum flow sheet as it's typically seen on the ACOG form. EDD is automatically calculated based upon the LMP. From one visit to the next, the pertinent elements charting the progress of pregnancy is entered. At subsequent visits, you can just go back to the same note to enter the progress over the pregnancy. Now let's chart the physical exam. Currently, all of the physical exam findings are normal. You can also click a Global Normal button when all exam elements are normal for that body system. For billing purposes, the CPT code for the antepartum care is entered. I'll also order the standard obstetric panel for the initial test to be done in the first trimester. If you're electronically connected to a lab, the orders will be automatically sent. Otherwise, you can print out your lab orders on a requisition form or prescription. Here we see all of the tests in the standard obstetric panel. This to the lab. Now enter your follow-up plan. Now let's take a look at the note we've created. Now I'll sign off on the note. Next visit, we can then make the note entry on the flow sheet. Using the waiting room solutions digital pen, You also have the option of entering data using the more familiar ACOG format prenatal form. If you're interested in learning more about how waiting room solutions can help you streamline your OB/GYN practice, you can enter your contact information and a Waiting Room Solutions OB/GYN practice specialist will contact you.